This is Chapter 1, Core Concepts in Maternal and Pediatric Healthcare Across the Continuum. First, we're going to talk about some challenges in maternal, family, and child care. So, health problems are becoming more complex, which means that there are more challenges for us as nurses to overcome. And we've talked a little bit about this before. Some of these challenges we have to deal with is to keep up with this growth of patients, increased cultural sensitivity, demands of the threat of chronic disease, so there are more people with chronic diseases, the challenges of infectious diseases, which we've seen recently. These natural and man-made disasters also play a part in that, with different things happening around us in our communities. So in order to have a significant and lasting impact on health promotion, we as nurses must extend our care beyond just the patient and the family. So we're looking at this, we extend it to communities, socio-political systems, national and global health arenas. So in order to be a part of that health promotion, we have to go a little bit beyond just the patients and families to extend it out. So let's talk about some trends. So epidemiology, when we talk about epidemiology, this is the process of investigating all the factors that determine the presence or absence of diseases and disorders. So let me say that again. Epidemiology is the process of investigating all the factors that determine the presence or absence of diseases and disorders. And if you look on page 15, box 1.3, there are some terms, just some definitions and terms for you to look at, but I'm going to talk about a few things here. So when we say maternal morbidity, we're talking about health complications from pregnancy or childbirth. So these can be acute or can be chronic. So morbidity, these are health complications from pregnancy or childbirth. Maternal mortality, this refers to the death of a client during pregnancy or within 1 year postpartum due to pregnancy-related causes. So make sure you understand the difference between maternal morbidity and maternal mortality. And so let me give you this statistic. Over 84% of maternal deaths from 2017 to 2019 were likely preventable. So the majority of mothers that died between 2017 and 2019 were likely preventable. We could have, something could have been done to prevent it, whether it was the mother, things with the mom, whatever it may have been. So the leading causes of maternal morbidity and mortality. So I'm just going to list a few of these leading causes. Excessive blood loss, postpartum hemorrhage, infections or sepsis, cardiovascular conditions, and mental health disorders. Now, risk factors for this maternal morbidity and mortality. So if the mom has pre-existing health conditions, if she is older in age, any lifestyle factors, that would be smoking, drinking, things like that, drinking alcohol. Pregnancy complications like diabetes, preeclampsia, and then social determinants as well. So fetal and infant mortality, so this refers to an intrauterine fetal demise, meaning the baby dies before it is born, so within the uterus. So intrauterine fetal demise is inside the uterus, okay? Infant mortality is after the baby is born, the baby dies for whatever reason. So the leading causes of fetal and infant mortality are congenital defects, preterm birth, and SUID, all capital letters, SUID. This is called sudden unexplained infant death. So it used to be called SIDS, okay, but now it's called sudden unexplained infant death, SUID. So racial disparities do exist, and efforts to reduce these are necessary. So we can help in this by educating patients. We can also train healthcare providers, and that goes along with that, inclusiveness, the cultural sensitivity. So we really want to work to educate patients and also train healthcare providers. Now, at the very bottom, it says Healthy People 2030. So there are goals that are set up by this Healthy People. And so every 10 years, they develop a new set of goals related to data that they've had and collected. So related to maternal child health, Healthy People 2030, some of their goals are to improve maternal and infant health with targets to reduce maternal deaths, reduce those severe complications, and reduce preterm births. The focus is really on increasing early and adequate prenatal care, vaccination during pregnancy, and reducing that mother to child transmission of diseases. It also addresses the use of substances during pregnancy and also promoting effective birth control to reduce unintended pregnancies. And the last part of this Healthy People 2030, it really encourages pre-pregnancy weight management and folic acid supplementation among women of reproductive age. So those are just some goals that are related to maternal health, specifically with those Healthy People 2030. So what is the role of the maternal newborn nurse? So there you see the roles listed here, and I'll kind of explain each one. We've talked about some, but I'll kind of give a brief explanation. So nurse advocacy, we are advocates for our patient safety, for autonomy, participation in decision making. So we need to make sure that we are advocating for our patients. We've talked a lot about therapeutic relationships and fundamentals and a lot in mental health. So you understand what therapeutic relationships are. It's important to develop that with our patients, patient-centered care, having that therapeutic communication to develop that trust relationship. Then health promotion. So we want to make sure, specifically in maternal newborn care, we want to make sure that we are participating in health promotion by counseling, prenatal education, childbirth classes, community involvement, anything like that to promote healthy behaviors. Injury prevention. So we want to educate on injury prevention of the mom and the newborn. So this would be throughout pregnancy, after delivery, postpartum care, follow-up appointments. So that prenatal care is key to that. Hopefully receiving that prenatal care to prevent any complications. And support and counseling. So nurses do provide a lot of support prenatally, during labor, during the postpartum period. This would be emotional support, comfort measures, coping strategies, and then they collaborate with other, healthcare workers. They work with maybe a lactation consultant to help the patient with breastfeeding. Maybe they have some other things they incorporate in postpartum care. So you can see how collaboration works together. It could also be maybe some midwives or pediatricians, maybe if they need a social worker. So there's a lot of collaboration with other healthcare workers within that time frame of the mother. And then legal and ethical practice. So obviously we must adhere to the Nurse Practice Act. We've talked about that a lot. There's also other things, the ACOG, so that would be related to obstetrics in particular. Ethical principles that we've talked about would be empathy, advocacy again, the autonomy of our patients. And so we just have to make sure that we are providing that ethical care and beneficence, that word that we've talked about before. Trends and issues. Family-centered care versus community-based care. So let me explain the difference between these two. So family-centered care involves integrating the family's needs and perspectives into the patient's care plan. So this leads to improved outcomes and patient satisfaction. So that's the family. So community-based care, this actually addresses like socioeconomic factors, access to health care, home visits, community programs, Anything like that would be community-based care. So make sure you understand the difference between those two. Midwifery. So this is a midwife, and we do have some midwives in the area. So midwives have been shown to improve maternal and neonatal outcomes for low-risk clients. They do provide comprehensive care for these patients across various settings. They collaborate with obstetricians, especially if the patient is high risk. They do a lot of, comfort measures and things like that with the patient, especially during labor. And there's different types of education and training, licensure that they have to go through to become a midwife, and it varies by states as far as what their requirements are. Home births. So some people do choose to, have a home birth. Is not a large percentage in the United States, but there are some patients that choose to have a home birth. A safe home birth would require a low risk patient. They would have to have a qualified provider there. If there was an emergency, they would have to have a plan in place for an emergency. And usually home births are associated with fewer interventions, so there's not medication, access to epidurals and things like that. But they do carry a higher risk of fetal or neonatal mortality, just because there's not direct access right then to emergency measures if something goes wrong. So just keep that in mind as you're educating patients. Scope of practice. So we must be aware, we've talked a lot about this, we must be aware of what our scope of practice is. So those are regulated by our state nurse practice laws. So we make sure we understand that, and we're following our scope of practice. We are working within that scope of practice. And so particularly for maternal newborn nurses, we're talking about assessments, interventions, and evaluations that would be specific to that perinatal period, labor and delivery, and all those areas. Abortion procedure and reproductive rights. We are going to get more into abortion in a later chapter, but just to give you some statistics, so about 25% of pregnancies, this is worldwide, about 25% of pregnancies end in induced abortion. There's about 1 in 4 U.S. females that have an abortion during the reproductive years, and the majority of these, now these are induced abortions, so elective abortions. These do occur before 13 weeks gestation. There are therapeutic abortions, which would be medically indicated because of the risk due to the patient or the fetal anomalies that may make the baby incompatible with life. So that would be considered a therapeutic abortion. There are different laws in different states related to abortions as far as legality and how many weeks they consider legal, weeks of gestation they consider legal. So you have to make sure you understand what your state laws are. And then the legal issues, medical malpractice is a concern, especially with obstetricians, gynecologists. Those are among the most sued providers. So, usually you would see things like maybe problems with the baby, if there was some type of issue, breech deliveries, things like that. And then postpartum mental health, we are going to get more into this in another chapter as well when we start talking about postpartum. But I'll give you some statistics, because postpartum blues, postpartum depression, and postpartum psychosis are 3 different things, and we'll talk more in detail about those in another chapter, but let me just give you some statistics. So postpartum blues affects over 50% of new mothers. This is characterized by mild symptoms like mood swings and sadness. Okay, so postpartum blues is mild. Postpartum depression is more severe. It lasts for longer periods of time, and this affects 6.5 to 20% of new mothers. Risk factors for developing postpartum depression would be a diagnosis of prior depression or maybe a lack of support. And when we start talking about postpartum depression, that can really affect that maternal infant bonding, which is very important at the beginning when the baby's born. It can also affect breastfeeding. And so, referral to mental health specialists is important during this time in assessing for symptoms of postpartum blues and depression. And then postpartum psychosis, it is rare, but it is a severe condition that requires immediate intervention because there's a risk for suicide or the mom is called infanticide, the mom harming her baby. So with postpartum psychosis, that would be considered an emergency because they do need immediate intervention. That is the end of chapter 1. If you have any questions, please let me know.